Nigeria is believed to be the most sickle cell endemic country, with 4 to 5 million people of the total population affected. One of the glitches in the effective management of sickle cell disease in Nigeria is the undermanagement of sickle cell pain, especially among children. With sickle cell disease, an inherited group of disorders, red blood cells contort into a sickle shape. The cells die early, leaving a shortage of healthy red blood cells, and can block blood flow, causing pain. When this blockage occurs in the small blood vessels in the inner lining retina of the eye, it can cause vision problems. People with sickle cell disease should be active, but intense activities that can cause them seriously out of breath should be best avoided. Patients should know their capacity and get hydrated regularly. Despite the challenges it presents, a warrior said, living with sickle cell can be challenging and the ability to manage the illness must be taken diligently.
One of our greatest challenge is stigmatization. People think living with sickle cell, that child can die anytime, you're dying soon. And some of our challenges is complication arising from sickle cell crises. We have a lot of complications, bone pains, liver problems, strokes, a lot. Even sickle cell itself, it's complication.
It is imperative for individuals to know genotype in time before choosing a life partner. Patients must also belong to a sickle cell group to access more information because information is key when it comes to management of sickle cell.
The only prevention now is knowing your genotype. Now, if you know your genotype and you know that your genotype is AS, do not marry someone who is AS like you. Marry only normal hemoglobin, which is the AA. That's the only problem. Then,
speaking on sickle cell treatment, public health pharmacist Dr. Olufunke Oyeneye noted that it is curable through stem cell transplantation, adding that a sickle cell patient can live productive life like anyone else and can contribute meaningfully to the society.
People living with sickle cell disorder have a lot of challenges. In addition to the general challenges that everybody is having, they need to eat appropriate and balanced diet. They need to be taking a lot of water, minimum of like 8 times 500 ml of water. That's like 8 pure water size per day, almost 4 liters per day. The reason is very simple. In the face of dehydration, when water is not much in their system, their red blood cells, which is supposed to be round, become sickled. And once it is sickled, this sickled red cell will move around all the body. And any part of the body that it gets to and is blocked, there's supposed to be a passage with the round cells. So a sickle blood is going. Once there is a blockade, there's going to be a problem at that point, and that is where such a person will experience crisis.
It is the right of the Nigerian children to know their genotype at an early age so as to make a better decision when necessary and with necessary preventive measures. In the future, having sickle cell children will be a choice to be made and not out of ignorance. Olaide Oloye, OGTV News.